When our next guest came out of the closet in medical school in the Midwest, it was a difficult experience. And he's here to tell us that for many people in the LGBT community, coming out in small towns is still that way. Please meet Dr. Ronald Holt. Thanks for being here.
Thank you very much.
So now you're originally from Nebraska.
I am.
And then you went to medical school in Missouri, and you said coming out was a difficult process for you. Tell us about that.
So I wasn't necessarily out in undergraduate, although I was dating a man during the time. But in the rural Midwest, it's very difficult to be out as an openly gay person and also be accepted. So it wasn't until medical school when I was able to get out of my parents' house and live on my own did I feel comfortable enough to actually come out and talk about who I was. Mm-hmm. Yeah.
And was that difficult because of your family, your upbringing, or just all of that?
I would say it would be a combination of everything. Growing up in Nebraska was very difficult, but also I went to a rural college in a town of about 5,000, Wayne State College, and so that was even more rural, and so there were a lot of people who had some very conservative beliefs, and so it was very difficult to come out.
Yeah, I mean, I grew up in Virginia and spent my summers in a small farming community called Sontag, and I loved it, but I've known I was gay ever since I was, very little.
Of course.
And it's hard in a rural environment to find quote-unquote gay role models.
Absolutely.
You think that's true?
It's absolutely true, and that's one of the reasons why I go back each year to talk, because there's not a lot of openly gay role models back in Nebraska, or really in the Midwest, for that matter.
So now, have you become a gay role model in Nebraska?
I
have. It Omaha? How far is it from Omaha?
Well, I was born and raised in Omaha, but I went to school in Wayne, which is about 2 hours northeast, and so it's about a town of 5,000. But the kids that come into that college really come from towns that are 1,000, even 500, or even less people. And so when I go back each year to volunteer to talk during homecoming, it ends up that a lot of the kids actually see me as being the first openly gay role model that they've ever seen.
Right. How much of the Matthew Shepard story resonated with you when you heard that? I mean, I was a different state, but for a lot of people, the murder of that young man on a rural road made people realize, wow, there is an LGBT community in rural America, and sometimes it's hard.
I agree with you, and that's part of the reason why I end up going back, is that there are a lot of kids who really struggle and are very closeted, and even though within society and in mainstream urban areas there is a lot of support, in those small town areas there is not. And so I think when you see tragedies like that, it really does, it's kind of a wake-up call for us to realize that there are a lot of kids that are still struggling and that need that support in those rural areas.
Right. Now, your practice is based in South San Francisco, so in the South Bay.
Yes.
I think people like to think that, San Francisco kind of resonates like a pebble dropped in a pond, so any place around San Francisco must be as open and accepting. Do you think that's true?
I would say, based on my experience, I've also, in addition to talking to college kids, I also talked to doctors' audiences across California and some in Hawaii as well. And my experience has been even talking with hospitals, even like an hour outside of San Francisco, it's much different. The atmosphere is much different, it's much more conservative, and there's a lack of a knowledge base on LGBT issues.
Now, do you think that is because it is based in the general conservatism of the medical establishment, or just a lack of knowledge, or is some of it religious based?
I would say all three. Yeah. And interestingly enough, they have some studies that have come out that have said, in general, over 4-year medical education, only about 2 to 5 hours of curriculum are actually devoted towards LGBT health, which is incredible. And so there's a lot of doctors that I go and speak to that have never even had any kind of formal education.
Well, I mean, this seems incredible to me, because, correct me if I'm wrong, but wasn't it 1976 when the AMA took homosexuality off the list of quote-unquote psychological or psychiatric
it was actually
disorders?
The APA had done that in December
American
of 70.
Psychiatric Association.
That's right,
yes.
in December of 73. Yes, and so, but even though that's happened,
I'm doing the math, that's 40 years.
I know, exactly. But even though that's happened, there isn't any kind of organized curriculum that's yet among all of the medical schools, and so it's kind of hit or miss. There are some schools that have a lot of education, and there are some that provide none for their doctors.
Now, even though you're an openly gay man, but your practice isn't exclusively LGBT.
No, it's not.
Is that difficult to balance? I mean, I've got an LGBT client, I have a non-LGBT client. Are psychological and psychiatric issues the same as gay and non-gay people?
Well, I would say that And most studies have shown that GLBT people have higher risk of depression and anxiety, also drug issues, and also alcohol use, and it's because of internalized homophobia, and also because of society's pressure against us for not being able to be out, for not being able to be open. It's a lot of pressure for a lot of people, and so they internalize those feelings, and then end up having it come out through more psychiatric issues.
Right. Now, so you go back once a year to specifically Nebraska or other places around the country to speak?
So I first started doing that in the year 2000, but then in 2009, I decided to kind of branch out and start going to other schools as well. And so over a matter of like the last 3 years, I've gone from maybe talking just at Wayne State College to talking maybe to a dozen schools across over about 5 or 6 states.
And tell me an especially moving or even disturbing story. I mean, something that caught you off guard. Like after you gave your talk, has anyone ever come up to you and said, Dr. Holt, I have something I'd like to talk to you about?
Well, I have a couple of things. One that was kind of something that happened years ago at Wayne State, and I was sitting there talking with a small group of people, and I was talking about religion and sexuality, and someone had opened up the Bible and started preaching.
In the middle of the class?
During class. And so, yeah, it really kind of caught me off guard, but I also realized that people who are struggling with their own sexuality are the first ones to hide behind something such as religion. And so I realized that person was struggling. So I treated them with compassion and care and just kind of listened to them and let them say their thing, and said, okay, you said what you said, now I'd like to finish what I have to say. And so that was one thing that caught me off guard. But innocently enough, that same person, like a year or two later, came back to me and didn't necessarily was coming out to me, but said he understood much more what I was talking about, had a better understanding of sexuality after hearing me speak.
Right, so not only from the mind, but from the heart, you helped heal some people.
Absolutely, yeah, and that was great.
We've been speaking with Ronald Holt, psychiatrist and advocate on the issues of LGBT youth. I'm David Perry. Thanks for watching. We'll see you next week on 10%.